And I like to be really active. I work out a lot. I ride bikes. I like to jog. I like to hike. All those kinds of things, and it was starting to impact that, especially the jogging and the hiking part of it. Anything where I had a lot of weight and impact on the left knee. So after about a year and a half, I finally went in and got an MRI and found out that I had ruptured my ACL, and I now had chronic severe arthritis in my left knee. And so the first lesson learned was don't wait so long after you have an incident. Go in and get it taken care of immediately is what you should do. So I began doing some research, and I met with several doctors. Talked to my primary care doctor first. He referred me, and all of the doctors I talked to in the Milwaukee and Chicago area had pretty much the same response when I would talk to them. They'd say, well, gee, you're 59 again, and they said you're too old to really repair your ACL and fix your knee. You're too young to replace your knee. So just kind of minimize your activities. Anything that hurts, don't do that. Ride your bike, don't jog. I was interested in playing baseball again. They said, no, don't really do that. They offered me an offload brace and cortisone shots or hyaluronic acid shots. And that was kind of the same story I heard, variations of that slightly, but pretty much the same story I heard from everybody. So that wasn't acceptable. It wasn't okay. It's like at the time I was in my mid 50s. Now I'm getting in my late 50s, and that's not the life I wanted to lead for the rest of however long I've got. And so, doing the research, I came upon Dr. Stone in the Stone Clinic, and it was the first time that I saw that the doctors and the clinic's goals were the same as my goal: returning to a fully active lifestyle. And I kept asking questions. Well, can I run? Nope, don't do that. Don't do that. Well, when I had the consultation with Dr. Stone over the phone, because I'm in Milwaukee, and we talked about that, and he said, that is our goal. That's why you would come here. And that's what we do, is we help return people to their normal activities. So that's what sold it for me, that this is the place that I need to come to get my knee back in the condition that I wanted. And so that was really the tipping point, because that was that connection of my goals and the doctor's goals were the same. And so a little bit of convincing with my wife and family members as to why I needed to go all the way to San Francisco from Milwaukee to get my knee repaired. And that was the same motivation, was that this is the one place that has the same goal that I have. And so that's why I came here, and my experience has been excellent. 4 days past surgery, 3 days past surgery, and I feel good. I've got a long recovery yet, but it's going in the right direction. And everybody on the staff I've met has been super. They're very friendly. They're very helpful, answer all my questions. It's really been a great experience. I get the sense that they all care about my recovery and how I'm doing as a person, not just as let's get this patient in and out of the clinic today sort of thing. So it's been a great experience. And again, don't wait, don't put it off. Take care of it right away, and keep looking and keep asking questions until you find that connection between you and the doctor where you're on the same page. Then you have the confidence that you're in the right place to get the work done.